Hello and welcome. I'm Steve Clemons, editor-at-large of The Hill. Thank you for joining us for COVID-19 and a responsible RX supply chain. Our virtual event looking at the resiliency of the prescription drug supply chain during a global pandemic. I'd like to thank our sponsor, the Healthcare Distribution Alliance, for their support of today's program. The coronavirus pandemic has upended our lives and forced a new normal upon us. While accommodations can be made for our lifestyle choices, there's little flexibility when it comes to our health care. For patients with chronic diseases and those most at risk from the coronavirus, access to regular medications isn't a choice. In some cases, it's a matter of life and death. In a pandemic, both the healthcare system and patients have changed their behaviors. As a consequence, concerns and fears have arisen surrounding drug availability and shortages. What are stakeholders doing to ensure that disruptions do not occur and there is collaboration between the public and the private sectors? And what plans are being put in place for the distribution of this corona vaccine once it becomes available? We're going to discuss all of this and much more with some of the smartest minds in health policy. But before we get underway, a few housekeeping notes. You can tweet us at The Hill Events. That's all together, The Hill Events. And the hashtag, there come special letters here, The Hill RX Supply Chain. The Hill RX Supply Chain. We're broadcasting live. We'll be taking your questions throughout the program, and I look forward to those. If you experience any trouble with the live stream, they say refreshing it will work. I hope. My first guest is national health expert and was on the front lines in the implementation of the Affordable Care Act. Governor Secretary Kathleen Sebelius served as the Health and Human Services Secretary under President Obama. She's now the CEO of Sebelius Resources, which provides strategic advice to companies, investors, and nonprofits. And she's my go-to person when it comes to issues of knowing what a smart healthcare system looks like. So, Kathleen, great to see you. Let me just ask you, I'll get to the point. You oversaw many of the institutions that we're now looking at today to help save this country, whether it's in, pushing the time curve on developing a vaccine and distributing it, whether it's on how you approve various dimensions of this in therapeutics. What would you say is going well? What would you say has just been awful?
Well, it's good to see you, Steve, and thanks for including me in this program. I don't think there's any question that the so-called Operation Warp Speed, having the United States government bet on a number of possible vaccine candidates early on, push that pipeline, has really accelerated the possibility of getting a vaccine for a brand new coronavirus faster than people could have anticipated. And that's good news. That will be beneficial to the United States citizens and hopefully to the rest of the globe. I'd say that, collaboration, cooperation looks very good, and the early investment makes sense. So pharma companies really are drilling down on now massive clinical trials and looking at safety results and hopefully, competing to get to the starting line first, but we could have a number of effective, safe vaccines in kind of record time. The very bad news, again, sticking with just the vaccine development, is that at every point along the way, this White House, this president, has undercut the public science, undercut confidence in the public health messages, and by doing that, may really discourage a lot of Americans from ever volunteering to get the vaccine, ever believing that it is safe and effective. So that is really not helpful. Communication strategies, clear, effective, scientifically based communication from the start is part of any public health crisis, about any public health recovery. And tying the vaccine to his political election, which President Trump has done for months and months, suggesting that there'll be an October surprise, there'll be an effective vaccine before the campaign, there'll be, something coming out, makes people feel like it's being rushed, that we are not on track for safety and effectiveness. We are really on track for some kind of political gimmick, and nothing could be more harmful to the confidence that we're going to need for a massive vaccination campaign and a 2-dose vaccination campaign. So that has some good points and bad points. I would say in the rest of this coronavirus response, we've seen much of the same. public science, which has evolved over time, and scientists have learned more and corrected themselves when they learn more, undercut consistently by the White House, who has a very different agenda in mind, not public health and safety, but getting the economy back running as quickly as possible, regardless of the deaths, regardless of the disease. So we've had a point counterpoint in the United States, and I think the clearest indication of that is Johns Hopkins in the fall of 2019 gave grades to countries around the world for pandemic readiness, not knowing what we were going to face. The United States was regarded as the most prepared, best prepared country in the world, and yet we have had, I think, unquestionably the worst response for any developed country in the world.
Wow. Well, you were featured recently, you were one of the stars in Alex Gibney's new movie called Totally Under Control, which profiles the response thus far in responding to the pandemic, managing, everything from Operation Warp Speed to other dimensions of this. And I guess my question is, you have some real heroes that pop out in the show, some governors that were securing PPE, some companies that were stepping up. And part of the discussion today is really around supply chain and the coming drugs and therapeutics, and whether Americans can have confidence that there is an infrastructure out there that's dependable enough that they can have confidence and faith in, regardless of the leadership. And I'm just wondering how you see that, because you saw states competing with one another before over masks and gowns. I'm wondering, when a vaccine rolls out, will we be able to have the confidence that it will be well managed?
We will only have the confidence if we have a national plan. And I think it's clear that the current president does not want a national plan. He has pushed every issue onto states and sometimes into the private sector in a way that is not transparent to anyone, and put burdens, I would say, on states as a former governor that they can't possibly achieve. So PPE is a great example. Rather than the United States mobilizing efforts through the Defense Production Act to make more stuff in America, to get it ready to go, or to use their incredible purchasing power and previous global contacts to purchase PPE and then distribute it in a fair and equitable manner, use the Defense Department logistics to make sure that equipment and machinery was at the right place at the right time, that we had everything from a virtual inventory of where there were extra beds to where there were personnel. The federal government under Donald Trump washed his hands of it and said it's up to the states. So states competed against one another. States competed against their own health systems. Often I've heard so many stories about states or a major health system ordering supplies only to have the federal government confiscate it at the border and put it into the stockpile, and then have the United States say the stockpile isn't for the states, it's for us, whoever us is. So we have had a totally misguided and inappropriate response. We need a national plan in place right away. We will only get that, I would say, with a new president who has made it very clear that he will have a national plan. And for vaccine distribution, for vaccine integration, for vaccine communication, we need that national plan to start right away. People have to have confidence in the safety and security. But beyond that, we need some transparency. Where is the vaccine going? How will it be available? Who gets it first? How many people? Again, that whole effort has been pushed to the states. States are submitting plans, but we need a national strategy for how this is going to roll out and how we can have confidence in, when the FDA says we have a safe candidate, that has not been pushed ahead, shoved ahead, or that the guidelines for the FDA, which have always been the gold standard in the world, have not been shortened or rushed due to political pressures.
Well, thank you for that. I can't even think of the number of business leaders, pharmaceutical industry leaders, scientists I've talked to since this pandemic began. And I think one of the interesting things is, while you saw a lot of society freeze up and get worried about drugs, therapeutics, et cetera, The other side of it is that a lot of the companies, beyond political control, bent over backwards to make sure that there were eventually no shortages in supplies. And so to ask, okay, what's the right way forward? In a few minutes, I'm going to be having Representative Alyssa Slotkin on. She passed legislation on strengthening America's strategic national stockpile to begin looking at that. And again, as somebody who had purview of what the private sector is doing, what the federal government needs to do, but what are some of the parts of the skeletal structure you think we need to amp up other than the national plan? But how do you look at the ecosystem and what you think is wobbly right now that needs to be shorn up?
Well, I think it's going to be hugely important, Steve, to do a really in-depth after-action report. We did that after H1N1 and found, for instance, that we didn't have sufficient manufacturing capacity in the U.S. for vaccines. So new contracts were let. We now have, I think, tripled the production capacity. That's good news. I think putting back in place the responsive red flag folks, national security and within the White House are going to be critical. But I think we need to figure out what of the protective equipment supplies and gowns and gloves should we actually make here in the United States? What makes sense? How we actually have production capacity here to deal with a global issue when everybody in the world is trying to find equipment and supplies at the same time. I think we're going to need a renewed confidence in public-private partnerships. Pharma has really stepped up. But what we know about stockpiles, and particularly stockpiles for therapeutics and vaccines, is unless the government has a pot of money and says to pharma, it's worth your time to invest in the science, to manufacture these drugs, to bring them to development, if there isn't a willing buyer, it doesn't happen. We're facing a possibility of antimicrobial resistance to antibiotics. We don't have a big pipeline of antibiotics in this country. So that's an example where with a government pool of money that happened after 9/11 and we had massive resources for making sure that America was safe and secure, which means some of the supplies that will be developed are never used, hopefully, are never put into action, but you have them in place of something happening. We need to be willing to fund proactively and not reactively.
Secretary, just real quickly, on a scale of 1 to 10, 10 being worst, 1 being best, how bad was the administration's response so far in COVID?
I think it's bad. I think the deaths that we are seeing in the United States are unparalleled for a developed country with the resources that we have. The burden on the Black and brown community and Native American communities is immoral. That we didn't move much more quickly and tell people the truth and really take the steps to secure the most vulnerable population. So I think we're at about a 9. Maybe we can recover some territory with vaccine development and distribution, but there is no reason in the world that we should have had this many deaths. And now we still have almost 1,000 people a day dying. And the virus, Steve, I'm in the middle of the country in a rural state. The virus is raging here, and it's raging in communities that have almost no capacity to deal with it because there aren't ICU beds, there isn't the equipment, and there isn't the personnel.
Well, Secretary Kathleen Sebelius, I really am grateful every time we get a chance to talk, but it's also very sobering every time I talk to you. So thank you so much for joining us today and helping us to launch our program.
Sure. Thanks for having me.